Everyone has argued about what is or isn't in the law, so we thought people might be interested in seeing what it will actually cost them individually. Behold the Congressional Budget Office's report to the Senate that shows the cost of Obamacare based on your family's gross household income. Let's cover some basics of how this plan works. Your premium is based on where your income falls in relation to the federal poverty limit, and this report picks the midpoint of each level in the column titled Middle Income Range. There are three financial components. The enrollee premium column is your personal contribution. The average cost-sharing subsidy column is what the government contributes on your behalf. The average net cost-sharing column is your contribution to the pool that subsidizes people who can't afford to pay for their coverage. A couple of things worth noting. First, look at the top row showing the lowest income level. These individuals will pay $600 premium and another $1,700 for their contribution to the general pool for a total of $2,300, yet they receive a government subsidy of $3,300. This means people at this income level get free health insurance and receive an extra $1,000 in presumably tax-exempt cash from the government. What? It's one thing to fully cover the cost for a lower income family, but give them free insurance and hand them an extra $1,000? That doesn't sound like affordable health care. That sounds like guaranteed welfare. The last column on the right makes it appear that they are paying 8% of their income to buy their insurance, but with the extra $1,000 tossed in, it is equivalent to them getting a 3.3% bump. We're not opposed to helping a truly deserving lower income family pay their premium, but getting an extra tax-free $1,000 is going to exacerbate their total dependence on the government. People receiving this benefit will permanently vote Democrat, and as we will show you later, immigration amnesty will add tens of millions of newly minted permanent residents to the euphoric audience that will lump an additional $1 billion to the taxpayer's burden for every 1 million amnesty recipients. And that's just for the premium. That doesn't consider the cost of one aspirin or ace bandage. Now let's take a look at the bottom row and read from left to right. Yes, you read that correctly. A family of four making a gross income of $102,100 will pay over $19,000 for their health care plan before they've paid 1 cent in taxes or their mortgage. Spread out, that comes to $1,591.66 a month. So ask yourself this question: where are you going to come up with this money? Look at the middle income range column and find your family income. To save you time, a family of four in the $54,000 bracket will pay an extra $750 a month. At $66,000, it's an extra $925 a month. At $78K, it's $1,075 a month, and at $90,000, it's an extra $1,183 a month. This is not spin from some ultra right-wing blog. This is from the Congressional Budget Office, which is notorious for grossly underestimating financial projections. But for now, let's stick to these numbers and picture your bill-paying cycle and consider how you would be doing with this extra seizure getting ripped from your bank account. How affordable does health care feel now? Does anyone have any regrets about how they voted in November 2008? The first step of correcting that is how you vote in November of 2010. Check how your congressional rep voted on this health care bill. If you feel misled in any way about what this health care law represented, take that bad taste in your mouth into the voting booth this November. We're sorry to say that the bad news gets even worse, especially as it relates to the honesty in which this bill was portrayed by its supporters in Congress. Explore the other content on this site as we delve into what is in the bill by showing you the actual letter of the law. Your blood pressure may spike when blatant contradictions are exposed, but you need to become educated on the facts for yourself instead of listening to partisan sound bites that don't come wrapped with evidence. The last election rode happy sound bites like hope and change. In this election, voters need to consider change or hopelessly drown in debt. The choice is up to you.